The next test that I'm going to do is I'm going to demonstrate the upper limb tension testing 3 for the ulnar nerve. What I need you to do is to lie down here. Susan, I'm going to be doing the upper limb tension testing 3, again with the provocative test being elbow flexion. So the first thing that I'm going to do is depress your shoulder girdle, because I'm going to start from proximal to distal. I have two choices. I can reach under your scapula and grab your shoulder girdle, but it's harder for me to do that. I like to come across your shoulder girdle and depress it. I'm then going to flex your elbow. I'm going to abduct your shoulder, and in this position I can continue to hold you here, or I can distract you, and I like to distract you better. I'll depress you proximally, and then I'll go down and distract you from this position. So once I have you abducted and your elbow flexed, what I'm going to do is I'm going to take you as full range as much as possible that I can. I'm going to get you up in this position, and I'm going to really work with elbow flexion, wrist and finger extension, and forearm pronation. And you should feel some pain. Don't feel any? That's wonderful. That's good then. If you feel no pain here, what I'm going to do is I'm going to add, this is a slider technique, okay? Which means that only the distal segment is moving while the proximal segment, being your neck, isn't moving. So I'm going to have you come into neck flexion, and that's a tensioner, and that should even be painful. I can even resist you coming into neck flexion, and that should reproduce the symptoms. Does it? Okay, if that reproduces the symptoms, what I may want to do now is I want to make sure that your shoulder is still depressed. I have you in flexion, pronation, wristic flexion also, and I'm going to have you push your neck back into extension. And that's a slider technique because that should relieve the stretch, and flexion is a tensioner technique. Any questions about that?
No.
Okay, any signs, symptoms? Anything different? Good. Okay, that was starting from the shoulder first. The next test that I'm going to do with you is the same thing, but it's just going to start distally. So I can distract the shoulder girdle, which I like to do. I have the elbow flex because I've already incriminated the ulnar nerve. I'm going to move. Any pain?
No.
Okay, I'm going to move your arm in abduction. And in this position, before I take you in complete pronation and elevation, what I'm going to do with you is I'm just going to move your wrist in this position. And if it isn't painful, I'm going to have you first turn your head away from the painful side. If the symptoms are reproduced, because I'm moving you distally, then I'm going to have you come on back. The symptoms should be fine. If they're not totally relieved yet, I'm going to have you side bend toward the painful side, and now they should be totally relieved. Are they? Mm-hmm. Okay, come on back. What we've done here is we've just reviewed upper limb tension testing with the wrist first. Susan, what I'm going to have you do now is a self-management or a home exercise program. We call it pour the water out. Grasp your hand around a cup and internally rotate and pour the water out. Okay? Come on back, externally rotate and lift it up a little higher. Let's try it again. Internally rotate, bring it back. Okay, externally rotate now. Make sure you go from internal to external. There you go. Come on back in. Simple as that. That's a home exercise program. All right? The next exercise I want you to do is the water pumping technique. You're going to put your fingers together. You're going to hold your arm up about shoulder level, and you're going to move your hands up and down. Now this is where the uninvolved limb can help the involved limb, because you can control finger flexion and internal rotation. So you can have the non-involved hand helping push the other hand. There you go. Okay, those are the two most common home exercise programs for radial nerve. Susan, I just showed you two of the most common radial nerve home management programs. I'm going to show you two more now. This next one is tip, please. Internally rotate, put your arm behind your back as if someone was going to give you money, and close your fingers over it. That's the tip, please. If you're in this position and it's not painful, take your head away. Side, yes, there you go. And that should create a little bit of pain. Come on back. That's one exercise. And the last exercise is the back massage. Put your hand, internally rotate, put your hand behind your back. There you go. And massage your whole back area. Make sure your shoulder moves too, because it depresses your shoulder. That's another home exercise program. Great. Now we're finished with the radial nerve self-management or home exercise program.